country of 1.4 billion people, we have a booming healthcare industry. In 2023, it was worth $372 billion. This year, it could cross $638 billion. That's the projection, $638 billion. Meanwhile, the costs are skyrocketing. For a lot of people, even basic medical procedures are becoming unaffordable. Like angioplasty, a minimally invasive heart procedure. In 2018, it cost between 1 and 1.15 lakh rupees. Now it is around 2 to 3 lakh rupees. Or kidney transplants, which cost 5 to 8 lakh rupees in 2018, but 10 to 15 lakh rupees now. All of this is because of medical inflation in India. In 2024, it hit 14%, which is the highest in Asia, 14% medical inflation. And the burden obviously falls on the people because standardized healthcare remains out of reach for many. 23% of Indians rely on loans just to afford treatment. There's debt, stress, and uncertainty. So what do people do? The obvious answer is health insurance. Yet 1 in 10 Indians are dropping out of health insurance. They're not renewing their insurance. Some are even downgrading, only paying half of the full premium, downgrading their policy. To understand why this is happening, let's also look at India's health insurance industry. It's worth over $15 billion. In 2021, it grew at a record rate of over 25%. The health insurance industry grew at 25%. And this happened for two reasons. One, because of the aftershocks of the pandemic, and two, because there was growing awareness in the middle class. In the financial year ending 2023, it grew at around 20%. But now it's losing momentum. Since the end of the last financial year, the growth has been a little over 10%, which is a 50% drop in 10 months. And it's because of rising health insurance costs. Like I said, medical inflation is high, hospital bills are growing bigger, so insurance companies are pushing for bigger covers. In 2022, a standard insurance cover was worth 3 lakh rupees, now it is up to 5 lakh rupees. Add special premiums and you have to pay quite a lot. A lot of people say they cannot afford this anymore, so they're either dropping out or downgrading. Last year, health insurance premiums rose by 20%, but the number of new policy holders increased by only 5%. It shows you the affordability crisis. It has left many families in a limbo. The rich opt for expensive corporate insurance plans. The poor rely on government schemes, which leaves the vast middle class in between. They are too rich to qualify for state-run programs and too poor to afford robust private coverage. This middle class is one hospitalization away from debt. What's worse is that our population is aging. Yes, we have a massive youth population at the moment, but this equation is going to change over the years. In 2022, 10% of our population was above 60 years of age. By 2050, that will be more than 20%. So we'll have more old people. These people will need health care. So India will have to prepare for that scenario. How do we do that?